Hello, I'm Ronnie Eldridge. Welcome to Eldridge and Company. The Deputy Mayor for Health and Human Services is Lilliam Barrios-Paoli, who I think is one of the best, if not the best, public servant the city has ever known. And I will talk more about her as we continue this interview, but she's my guest today, and I welcome you.
Thank you, Ronnie.
I'm very serious about that.
Thank
you.
you
are an outstanding public servant because you talk to people, you listen to them, and you're very honest with them. Your agency, you have a portfolio that covers several agencies. How many? What?
So the Human Resources Administration, which is really the agency that does cash assistance and Medicaid and food stamps, but also deals with people with AIDS and protective services for adults, food. Then I have the Department for Homeless Services. I have the Agency for Children's Services, which is Child Abuse, Neglect, Foster Care. I have DYCD, which is Youth and Community Development. I have the Department of Health. I have the Health and Hospitals Corporation, which is a municipal hospital system. I have the Medical Examiner.
That's it.
And I have the Office of Domestic Violence.
So that's
and the Office of the Aging, the Department for the Aging.
Do we consider that whole portfolio people who are the most vulnerable in the city?
Yes, and I think it's really all the human services and health and human services in the city.
Yeah. So these are the people that we talk about in a way when we talk about the inequality between.
Yes.
How are we going to change that?
So, well, inequality essentially, in order to fix inequality, we have to first and foremost deal with a minimum wage. If you make the minimum wage, you could see it incrementally. If you do $13, X number of people come out of poverty. If you do $15, 800,000 people come out of poverty, and it's really the way to go. There's no mystery to it. You either increase income or you increase supports. There's no two ways.
You have to do one or the other.
Absolutely.
And that's the role of government, right?
Absolutely.
But there are different ways of measuring poverty. So the old line, when they used to say there's a certain million people living below the poverty level, we don't use that old standard poverty level anymore, do we?
So the old standard was created in the 50s when food was the most expensive thing you can buy. And so it was food times 3. Whatever a food basket would cost, times 3. Nowadays, that's not the truth anymore. In places like New York, housing is extremely expensive for older people and poor people that don't have the adequate medical coverage. There's that hole that you have to fill, and out-of-pocket medical expenses can be very high, particularly your medicines, things that are not covered by Medicare, for example. They don't cover hearing aids, they don't cover glass, things that are not covered. So for somebody living on Social Security or any kind of fixed income, anytime you have an extraordinary expense, then you make really difficult choices.
You can drop down.
Absolutely.
Right.
Absolutely.
So what do we do now? We have a poverty level that we consider that takes into these things.
Right. So there's a group called CEO, which is the Center for Economic Opportunity. It was created by Mayor Bloomberg, and they came up with a different poverty standard, which takes into account not only your income, but also benefits that you may get, but also they factor in the real cost of housing, the real cost of medical expenses, other things that are really what make people have their income eroded. And I think that is very valuable. Because when you look at the poverty measure, there's a very large number of people, almost 48% of New Yorkers live in poverty.
It's
and
incredible.
That is staggering.
So was there ever a time, or is there a place in the world where you don't have that many people, poor people, struggling?
Sure. I think that there are other places in the country where you don't have that immense, that large level of poverty. But
well, is that because they have, the same percentage?
Right. Well, I think part of it is that in New York City we have a large number of immigrants. We have a very large number of people who work in, service jobs, entry-level jobs that don't pay enough. When you think of people who work in places like McDonald's, Burger King, Target, retail in general, they pay very low wages.
And then it comes to you from all ends, because then they live someplace further out because the rents are lower, and then they pay so much for transportation that you can't even afford it. So how do you sit in your office and try to eliminate this or do something about it when it's all over?
It is. Part of it is, for young mothers, daycare is extremely expensive. There are people paying as much as a third of their income for childcare, which is untenable. Some people are paying 50-60% of their income in rent. So what happens is that you have a lot of food insecurity. That's why soup kitchens and food pantries are overly used, because people run out of money at the 20th of the month, and then they go and get things from the food pantry or go to the soup kitchen. A third of the people living in shelters work full time.
Yeah.
How counterintuitive is that? And part of it is that if you're making $20,000 a year, and the cheapest apartment you can now get in any neighborhood is $1,200. That's for one bedroom. That if you're making $20,000 and you're paying $15,000 in rent, that doesn't leave you a lot to do anything with.
Right.
And so, anything can cause a crisis, and you fall back in rent. You don't pay the full rent. Some people pay half the rent, and eventually the landlord gets tired of that and evicts you. So it's a very complicated.
So do we ever come to the conclusion that capitalism just doesn't work?
Well, it works for some people, clearly.
Very much
well,
so, right.
But it doesn't work well for everybody. And I think there's when we got together and decided to live in high-density places, there was a social compact that had to enter into place. And that social compact always said that if you worked full-time, you could support a family, you could live well. We've broken that. We can't anymore. The minimum wage in the city of New York does not cover the expenses of most families. And so either you get a lot of support from government, which in many ways is sort of giving welfare to the corporations, right?
Yes.
So, when any of the companies only pays minimum wage, people are eligible for food stamps, they're eligible for Medicaid,
So we're subsidizing their profits.
Correct. And so we have to get to the point where there's nothing wrong with making profit, but there is something wrong when you're making profits at the expense of people not making a wage that is enough for them to support their family.
That's such an interesting way to look at it, that if you're a corporation, you pay the minimum wage, you're making more money, we're really substituting. That doesn't get phrased when you talk about it, does it?
Yeah, no, it doesn't. And I think, people talk about, welfare state and we're supporting all these people, but in essence, we're subsidizing corporations when they're paying such low wages, because all of these people are eligible for a myriad of benefits, and they receive it. Many of them do. So it's an interesting thing. In lieu of benefits, we're giving them a subsidy.
And what about the people who, even if they earn more money, wouldn't be able to really take care of themselves? What size of that vulnerable population? What is the size?
So there's a large number of people. As you know, we're all aging, and we do that every day. And as we live longer, there is more likelihood that you will need more support. And we now, in the year 2020, there will be more older people over 65 than there will be kids in high school in the city of New York. So we're an aging city. There will be more people of 65 and over. As we live longer, we need many more supports. Even if forget the people who have dementia or Alzheimer's, that's another group of people. But, if you moved into an apartment building that had no elevator and you're 4 floors up, when you were 40, that's fine. You can negotiate that every day. You're older, you can negotiate those stairs more than once a day, if that much. And so you're trapped. Yeah. So many people that receive home-delivered meals, it's not because of anything other than they can't really go shopping and they can't, or they maybe not cook for themselves. So there's a lot of supports that are included.
How many meals do we deliver, or are total?
So the Department for the Aging does about 28,000 meals every day in centers. And they do about close to 20,000 meals in that they deliver to people at home.
And that doesn't count City on Wheels and other private.
Well, that is sort of the system at all. But every day, 20,000 meals.
Yeah, that's a lot of people.
It's a lot of people.
So beyond the elderly?
So, there's the disabled community, there are children who are handicapped. I mean, there's all kinds of other people who need supports. And we're very fortunate because New York City is very compassionate, and there are a lot of programs that serve these people. But there are other people who also need support, and we tend to divide the universe among the deserving poor, and we think of the elderly, the disabled, and then there's people that we think, well, they just don't want to work.
Right.
And it's just not true.
Was that historic, always the perception of poor?
I think that there developed a sense that everybody should pull themselves by the bootstraps, and everybody should work full time.
Right? Yeah.
But not everybody came into the world with the same equipment. people like me and you had parents that were okay, and we were educated and we were lucky. I mean, I certainly don't remember ever choosing. Nobody asked me what parents I wanted to get, or And I think that their kids have come into the world with a drug addicted mom, and they come into the world in poverty, and they come into the world with some form of learning disability, and all of that puts you way behind the 8 ball.
And then, of course, the number of people who, I don't know, where does illiteracy come? Where does that start?
Learning is a tricky thing. Not every kid learns the same way. And I think that we teach only one way in schools. And I think that some children need extra supports to learn to read. And if you didn't learn to read by 2nd grade, it's going to be very difficult.
The chances are the parents aren't reading. Is that true?
Probably they don't read to the kids, or they have a very low level of literacy themselves.
Yes.
Absolutely. And it's so important to read to children and to talk to children constantly from the time that they're born. Even if you think they don't understand, they do. Yeah. Actually, I was listening to something today. Most babies can work a smartphone before they're 1 year old.
That's amazing.
I don't know about most adults, but most babies can.
That is amazing. Right. It's we were talking about making medical advice and taking care of patients, the relationships between providers and patients, and how many patients don't understand and how dangerous it is. I mean, it's just all over, isn't it?
So health literacy is really important, because most of the time when the doctor talks to you, you have no idea what they're telling you about. Yeah. No, and in fact, the fact that most of us, when we go to the doctor, you get nervous anyway.
Yeah, right.
So it's always a good idea to bring somebody along. But I think that the training of doctors, particularly primary care doctors, is really important for them to understand how to talk to patients, and for patients to know how to ask questions. And it's something we don't do too well. And most of the time,
And what about education?
What about education? Look,
do your agencies interact with the Board of Education?
Yes, quite a bit. And I must say that we're really fortunate in having the chancellor that we have now. Carmen Ferrin is quite an extraordinary human being, and for a long time we did not have an educational leader, and I think that she is an educational leader. She is very clear in what she wants to accomplish, and we work very well together. I interface with them because the Department of Health does school health, and that's really important. I have the Department of Youth and Community Development, and we do all the after-school programs and the summer programs. So there's a lot of interface. ACS, unfortunately, the teachers are the first line of defense many a time, figuring out if a child's being neglected or abused. And we've had some very
horrendous stories.
Yeah, horrible, but also good stories, and that teachers have detected a bad situation and stopped it before it became worse.
Right.
So there's a lot of interaction.
How do we? Everybody's talking, I mean, all the political candidates and everything talk about the middle class. What do we consider the middle class?
So it's interesting because I think, we all like to think of middle class. Middle class is very large, in the and a lot of it is perception. I don't think you're really a middle class in New York City unless you make upwards of $80,000.
Absolutely.
And, there's a lot of people who make 40-something who think they're middle class, but they're struggling. And because of the erosion in wages, they just don't have...
And the cost of living. Yeah. But when politicians talk about middle class, they're not talking about people with 80,000, are they? No. They're talking about the votes they want, but they're really talking about the working poor.
The working poor. And it is a working poor. I mean, I think, essentially if you have, unless you have two incomes, anybody who makes 40,000 and has a couple of children, it's virtually impossible to make ends meet.
Right. You can't buy food for enough. You don't qualify then either, do you, for the food stamps?
You're sort of in the twilight zone. You make too much to qualify for food stamps and other benefits, but you don't have enough to really make ends meet.
It's like Medicare with a drug program.
Precisely.
You're in the donut, or whatever that means.
Absolutely. You're in the hole.
It's terrible. So what are we going to do about homeless? Do we really have now more homeless people than we've ever had?
Yes, we have.
Is it both with families and single people?
Yes, absolutely. We are an all-time high. We've come down from the all-time high. We were over 59,000. We're now at 56.8 today. But still, it's a huge number. It's sort of the meeting place of not enough really deeply affordable housing. There's not enough. We lost over 200,000 units of affordable housing in the last 10, 12 years, by a combination of apartments becoming they went out of range stabilization, or Michelamas got converted, or those
everything.
kinds of things. But also the fact is that we haven't built deeply affordable housing in a very long time. So that's a real problem. And New York is a hot rental market. It's a hot place to live. It's a wonderful place to live. The problem is that if you don't have enough of an income, it's not a very pleasant place.
So you said a third of the homeless population are working poor, or working?
Yes, are working, and they just don't make enough to pay their own apartment. So we're doing different kinds of rental subsidies, and we're moving people.
Which was not in the previous administration? Did
No,
they end?
They ended it. They had the Advantage program, and you see, if you look at the numbers, the numbers of homeless were going down during Advantage. When they stopped the Advantage program, the numbers just
went right up.
Went skyrocketing, and that's the problem we're in. We can't, the mayor's trying to build more affordable housing. That'll take a little bit of time, and in the meantime, we're trying to move people through rental subsidies. But it's a tight market, and it's difficult.
It's so what do we do? We're just trying.
So
move slowly.
We're trying. We're moving slowly. I think we're trying to talk to developers about different kinds of housing. For example, for the single population, a lot of these people used to go to SROs, and we don't have SROs anymore. And most single people working full time don't make enough in this population to ever afford an apartment.
It's interesting because when I worked in the city government, which was very long time ago, the SROs were there and were just beginning to be demolished.
Yes,
and they served a very valid purpose.
Absolutely.
They were able to be there. They could also get meals if it was a boarding house, which is basically what they were.
That's what it is. And so we have to recreate some of that in a very decent, humane way, but we have to do that. There are people that, women, that single women who've worked in, like a receptionist job that may not have a pension, that live on Social Security. Unless they were in a rent-controlled apartment, they can't afford it. So remember the Martha Washington, Salvation Army places?
Right.
That's where people
Even
live.
the Barbara Sun Plaza.
Yeah, that's right. And it was good. It was okay. And they got socializing, and they were.
It was great. Yeah.
It was a good thing. So we have to recreate some of that because it's just not good. Not everybody can have their own apartment. And you know what? It's not even the best.
They don't
thing.
even want their own apartment.
And it's not the best thing for people.
Yeah.
People need to be stimulated and socialized. Social isolation is perverse.
Well, co-housing has become a very popular thing outside of the city.
Yes.
Have we done anything? There was a group in Brooklyn that was trying to do it.
Yes, there's the New York Foundation for Senior Citizens that was trying to do that. We're exploring more that kind of situation because honestly, young people do it all the time. Students do it. Young people that just come into the city to get their first job do it. So we have to be more creative in those things. And sometimes a mom with a baby, sharing an apartment with somebody older, it's a good thing.
She's got a babysitter.
It's a very good thing. She got a babysitter, but she got some advice along the way too, which is very good.
So the attempt to downsize people in their apartments that were subsidized, that's out the window?
No, we're trying. The thing is that, look, it's sort of a difficult thing. First of all, you have somebody who now, was in the apartment, had 3 kids, the husband passed away, the kids move along, but this is where her memories are. This is the place that she knows at home. So the only way to move her in a decent way, in a humane way, is to get her a place very much in the same building or nearby with more support services so it's not a loss in her mind. And that's what we're working with.
Or she could convert to co-housing.
That's true. That is true. And that we're exploring. We're looking for people who may have a relative or a friend, even in the housing authority, who may have a 3-bedroom, a 2-bedroom, and can spare a room and house somebody
Now,
else.
who does that work?
So we're doing it in conjunction with NYCHA, with the Housing Authority.
So it's the Department of Homeless Services.
Homeless Services, yes. And HRA is very much working with us. Actually, the advantage of having somebody like Steve Banks at HRA is that he knows homelessness so well that he is a real partner for Gilbert Taylor, who's the Commissioner of Homeless Services.
For people who don't know who he is, he was the head, wasn't he?
Yes, he was the head of legal aid.
Yeah, and sued the city on numerous occasions.
Absolutely,
including you.
Me included.
So
but he knew where all the the things that needed to be changed.
That's very interesting. Yeah. So, what do you think you can get done?
So I would. Well, there were 2 things. I when I first started, there was this thing called WEP, Work Employment Program, which essentially put people in relatively menial jobs with no training, and at the end of whatever, 6 months, 8 months, they would be put in another menial job, and it was sort of a road to nowhere. And I remember talking to Steve Banks, and I said, the first thing I want you to do is seriously look at ending WEP. So he did. And, this happened around 6 months ago. We're now implementing it. So I said to him, well, now I can declare victory, right? So I think a lot of the welfare reforms that...
So how did you change it?
So now what he did is essentially, we want people to work. No question about that. But we want people to work in places where they can be learning skills so they can get a better job. That's the point. The point is to get you out of welfare in a way that's meaningful. So we're allowing many more people to study, so they can go to either a 2-year college or 4-year college, which is a big change. We are allowing people to get skills and training, which was not allowed before. We're trying to give them meaningful, you can choose now to go and do a mentorship with somebody, and we allow it to happen. So
it's like the old-fashioned, what was that, the community, in the old Johnson days or something, you could be an intern or
that's right.
in a nonprofit and learn that.
That's right, and learn skills.
Yeah.
I mean, the point is to learn skills so you can really be self-sufficient. And so all of that is being put in place as we speak, and I think that that's a great reform. We've stopped sanctioning people for just sanctioning people. We found out that a third of the people who ended up in shelter had been sanctioned the prior year and their case terminated. So we were creating our own homelessness feeding frenzy there. So, so all of those changes at HRA, I think, are going to be real welfare reform, as it should have been implemented in terms of really bringing people to self-sufficiency.
It's not punitive, it's supportive.
Right, and it's a saying, people are not on welfare because it's such a lovely life to live. People are on welfare as a last resort, and we want to work with them to get them to a better place.
Do we have to convince the public that that's true?
I hope so. I think so. But I mean, the level of money that people get through welfare,
so little, isn't
it is so little. It is impossible to live with that. The shelter allowance, I mean, the amount of money they give you for rent is $320. It's impossible.
Yeah.
So to a grand degree, I think that the myth around welfare is has to be dispelled and changed. So that's a big agenda for me, because I think that that's the real poor people that have to be moved along. And then homeless, I mean, I'm trying very hard. I'm putting a lot of energy, and hopefully we'll get the numbers down. And then there's a lot happening in health and reform around health, financing health, and health and hospitals is the city hospital. And in a sense, that's where poor people and people in the city go for their health care. And so making it healthy and solvent and quality care, and making sure that, when you go to any of our municipal hospitals, you have a good experience. That's really important. So that's a very important place. The Department of Health, of course, they have all of these, good health things like no salt, no sugar, no fat, but no smoking, and that's really important. And obesity is a big agenda. Chronic issues like diabetes.
Did we have trouble with inoculations?
We have a really high level of vaccination in the city, very high, and that's partly because you cannot go to school
without you vaccinate.
Right?
Yeah.
And I think by and large, most people do vaccinate their children.
And that was never considered controversial. How did you get to the point where these are the things you do?
I've been very lucky. I mean, most people have, I have jobs. I mean, I have something that is really important and matters a lot. I mean, I can get up in the morning and I know that if I really get it right, I can make a difference, and that's a gift.
And you were born with it.
I always wanted to do this. I mean, there's not a moment in my life where I didn't want to be helpful.
Make things different.
Yeah.
I read someplace you said your mother used to go to the poor neighborhoods and distribute clothing.
Yeah, she would ask all her friends to give her their clothes. And she would have all this clothing in the trunk of her car. And she would go certain places and just give them away. And she did that the same thing at home. There were always people invited to have lunch that you never met before, but somehow came across them.
So, and you've been commissioners in the city administration in a lot of agencies. So you certainly have the knowledge.
Yes, I've been commissioner of 5 different agencies. HRA, which reports to me now, and the Department for the Aging, which reports to me now. But I've done housing, and I've done labor relations and civil service, and so. But it's good because all of these things come together, and I think that's why I can look at something like homelessness and understand why I think other agencies are creating my problem, and bring them together.
And then you also worked for United Way.
I did. And
Safe Space, which were two organizations on the other side.
Yes.
Right? With a need, but you don't look that old.
I am.
No, you're not. At
you.
What age did you
Thank
start all this?
So it's funny.
And you have a doctorate?
I have a doctorate in anthropology from the New School, and I taught, and I thought I was going to be in academia, and I came into the city as a temporary measure because I didn't want to be. I was teaching at Rutgers, and I, didn't want to stay in academia really, but I thought that's where I should be. If you have a doctorate in anthropology, that's where you do, right?
Yeah.
So I came very early in the Koch administration and found my calling, right? But I was really, I was very fortunate. I mean, I was at HRA at the right moment. I mean, I was there actually when we signed the consent decree for homelessness.
Yeah.
I mean,
and you also ran a hospital.
I did. I ran Lincoln Hospital.
Which in my days was the major task in the city.
It's a great place.
Yeah.
It's a great place, and with some wonderful doctors, and really, it's a real community hospital. It's a very good place.
So we've come to the end, but I must say, you've more than proved my thesis that you're the best civil servant that we could find. Thank you so much, Lilliam.
Thank you, Ronnie.
Thank you.
Thank you.
If there are any people you'd like to hear and topics you'd like us to explore, please let me know. You can write to me at CUNY TV, 365 Fifth Avenue, New York, New York, 10016, or you can go to the website at cuny.tv and click on Contact Us. I look forward to hearing from you.